I said, Chapter 6, A and P. Topics, we're going to learn about body organs and structures and the body system. Locating body organs and structures. A couple ways we can locate organs: by visualization, seeing this, or topographic, by knowing where it's at, like a map. We're going to start talking about the muscle skeletal system. The skeleton consists of the three main functions, right? It gives the body shape. Without skeleton, we'd be just big blobs rolling around on the ground. So we need this bone structure to hold the support. It protects vital organs. For example, your brain, heart, lung. These are all encased in bone and for protection. And it provides movement. So without the bones and the muscles, we wouldn't be able to move. The skeleton consists of the skull, spine, ribs, and sternum, shoulders, upper extremities, pelvis, and lower extremities. So how many bones do we have, I'm asking? Depending on the person, but usually 206. And what do I mean by depend on the person? Well, it depends on if you have all your teeth or not, right? Because teeth are bones, so you may be missing some teeth. So you may be missing a few, but on average, it's 206 bones. The skull, bony structure of the head, right? Its whole job, the skull, to protect the brain. That's its biggest job. The cranium is the top, back, and sides of the head. And the front is your face, or your front of the skull. Cranium connects to the facial bones. We have the mandible, which is your lower jawbone. The maxilla, which is your upper jawbone. Nasal bone, your orbits or your eye sockets, and your zygomatic arches, which is your cheekbone, right? Some people have more distinguished cheekbones. For example, people of Hispanic heritage or American Indian heritage have distinctive cheekbones. Here's a nice picture of the skull that consists of your cranium and face. And as you can see, your skull has several bones that are fused together. We'll talk about these fissures or the fusion lines later on in the pediatrics. But you can see the frontal bone, you have the parietal bone, temporal bone is in the temple area, and the occipital bone is in the back of the cranium. Spinal column, we have 33 vertebrae, and their job is to protect the spinal cord. I always tell my students to remember 33 and how many of each you have by breakfast, lunch, and supper. Normally, you have breakfast around 7 a.m. So you have 7 cervical spine, which is your neck area. Next, you eat lunch around noon or 12. You have 12 thoracic or chest area where your ribs are. All your 12 ribs attached to the thoracic vertebrae. Then it goes down to usually have supper or dinner, or however you call it, at around 5 p.m. So there's 5 lumbar or your lower back. And then we have 5 sacral bones, and then which forms the back of your pelvic or your hip area. And then you have 4 coccyx bones that are fused together, and that's your tailbone. The spinal cord is essential for movement, sensation, and function. And here we go. The thoracic has 12 ribs and sternum. Protects the heart, lungs, and major blood vessels. Major blood vessels would be your aorta for your artery, and your 2 vena cavas. You have a superior, which we learned last class. Superior means up, so it's the upper or the higher one. And the inferior, vena cava, is coming from your lower body, your lower extremities. Here's a nice picture of your skull and your spinal column. And it shows the division it's talking about, the cervical, thoracic, and the lumbar. And then you can see the numbers I told you, 7, 12, 5. And the sacrum is the back of your hip, like right here. And then your coccyx. The sacrum is fused together as well. There's 5 bones that are fused together, and the coccyx has 4 bones that are fused together. The pelvic, the bones that make up that are the iliums, the ischiums, the pubis and the hip joint, or the hip, I'm sorry. It's a ball at the proximal end of the femur, right? So it's a ball and socket joint is what your hip is. Lower extremities, we have a femur, the large bone in the upper leg, right? Patella, that would be your kneecap. And the tibia and fibula, which is in the lower leg, the tibia being in front, the fibula being in back. You can always remember the tibia as a true bone or true in front. And your ankle consists of lateral malleolus, medial malleolus, and torsals. Then we move down to the foot. We have metatarsals, your heel, and your phalanges, which would be your toes. Upper extremity, your clavicle. That's that bone that goes across the top of your chest. Remember, it can be fractured very easy, and when it does fracture, it's pretty painful for your patient. The scapula is your shoulder blade, your acromion process, and acclivitor joint point is where the clavicle meets the scapula. The humerus is your upper bone in your upper arm, your funny bone. Your radius and all is in your lower arm or in your forearm area. Remember, your radius is always on your thumb side, and it radiates. When you spin your thumb up and around, that bone radiates with it. We have the carpals on the wrist. Then we move down to the metacarpals in the hands, and the phalanges are your finger bones. So your toes and fingers are both called phalanges. Here's a nice picture of your skeletal system underneath what would be your skin. Kind of get a good aspect of where everything lies. Joints. Formed in bones connect to other bones. There are two types, ball and socket. We talked about one, that's your hip joint, but your shoulder joint is also a ball and socket. And a hinge joint is more like your elbow, your wrist, your ankles, and your knees. Talk about the muscles a little bit. You have voluntary muscles, your skeletal muscles. These are muscles that I can control, right? I can squeeze and make a bicep. Involuntary, smooth muscles. These are the muscles I can't control, like digestive muscles, digestive muscles, stuff like that. We'll talk about it later, but in your blood vessels, there's a layer of smooth muscle that helps it contract or dilate. We have no control over that. And then cardiac muscle, and it has automaticity, which means the heart's ability to generate and conduct its own electrical impulse. Without this, it wouldn't work and we wouldn't be here. 3 types of muscle. Respiratory system. It brings in the oxygen via inhalation, and excretes carbon dioxide via exhalation, right? We breathe in, we inhale, we breathe out, we exhale. Air enters the body through the mouth or nose. These are called oral pharynx or nasal pharynx. Then it goes into the pharynx, which is the back of the throat pretty much. Air moves towards the lung. We have an epiglottis, which is this finger-looking tissue that when you swallow, it will close up over your trachea. This is covers the glottis, which is the opening of the trachea. Larynx is your voice box, containing your vocal cords. It also has the cricoid cartilage that forms the lower portion. Then we go into the trachea. The trachea is the long tube that goes from the larynx to the lungs. Once we reach the lungs, it splits into bronchi. It'll split into smaller bronchi called bronchioles. And then we go all the way down to the little air sacs called alveoli. Our diaphragm muscle is what controls our respiratory or our breathing. Here's a nice picture of your respiratory system. Inhalation. It's an active process. That means it takes energy or work to do. The diaphragm and intercostal muscles will contract. When the diaphragm contracts, it'll move downwards, and the ribs will move up and outwards. This creates a negative pressure, which pulls air into the lungs. So it is an active process, which means it requires energy and effort or work to do. Now, on the flip side, when you exhale or exhalation, it's a passive process. The diaphragm will relax, our intercostal muscle will relax. It creates a positive pressure. The air is then pushed out of the lungs, and we exhale. These are very important. You're going to see these on tests. Um, in your class, you're going to see this in the test on national. The difference between ventilation and respiration. Ventilation is the moving of gases to and from the alveoli, so the in and out of the air. Respiration is the exchange of gases between the cells and bloodstream. So in the alveoli, when the oxygen is offloaded through the thin membrane of the alveoli into the thin membranes of the capillaries, and that exchange happens, that's respiration. So ventilation is actually breathing, and respiration is when that gas exchange happens way down into the lungs. Oxygenated blood is carried from the lungs to the heart and pumped into the rest of the body. At the cellular level, O2 or oxygen is exchanged with cells and it picks up the waste product of CO2, which we will go into that more detail next chapter. But it uses the oxygen for energy, that and glucose. And during this process, the waste product is carbon dioxide. Deoxygenated blood will go back to the heart and then pumped to the lungs to exchange the CO2 for O2, and then the CO2 will be exhaled. Here they're showing the comparison of a child and adult respiratory anatomy. If you look at it, child has a really small nose and mouth. Child has more space to taken up by the tongue, so you have big floppy tongues compared to their airway. Their tracheas are narrow. Cartilage is less rigid and less developed, and airway structures are more easily obstructed. Right? A child goes unresponsive for whatever reason. Their tongue relaxes, it'll slide back, and big floppy tongue will cover up their little airway. So, cardiovascular system, moving on. It consists of heart, which is the pump, the blood, which is the fluid, and the blood vessels, which is the plumbing, right? So we got heart, blood, and blood vessels. 4 chambers in the heart. The top two are your atria. And the lower 2 are your ventricles. So you got a right and left atrium and a right and left ventricle. And left ventricle being the largest portion of the heart because it pumps blood to the body. Pathway of blood through the heart. It enters through the right atrium. It'll go through the tricuspid valve down into the right ventricle. The heart contracts. It'll shoot blood out through the pulmonary artery into the lungs. Now, while I got your attention, the pulmonary artery is the only artery in your body that carries deoxygenated blood. All other arteries carry oxygenated, but the pulmonary artery does not. It carries deoxygenated. So it's got the waste products in it. Gas exchange will happen at the cellular level into the bloodstream. The blood will be pumped back to the heart through the pulmonary vein. It's the only vein in your body that carries oxygenated blood is the pulmonary vein. Into the left atrium, it goes through the bicuspid valve, down into the left ventricle, and then up and out through the aorta. Now, let's go back to the pulmonary vein and artery so we make this less confusing. The pulmonary artery is carrying deoxygenated blood, but it's an artery because it's taking blood away from the heart. Anything taking blood away from the heart is classified an artery, no matter what's inside of it, if it's oxygenated or deoxygenated. So if it's coming back to the heart, it'll be a vein. But just know that pulmonary artery carries deoxygenated blood and the pulmonary vein carries oxygenated blood. Here's a nice picture of your heart. Nice little diagram. And I didn't say, but it comes back from the body through the vena cavas, right? You got the superior, inferior vena cavas. It'll go into the right atrium. This is the cardiac conduction system. We're talking about the sinoatrial node, the pacemaker, the SA node, and then the AV node, and then we go into the bundle of His, the bundle branches, and then the Purkinje fiber at the very end. Important arteries to remember. The coronary arteries. These are the arteries that are on the heart that feed the heart muscle itself. You would think that the heart just absorbs nutrients and oxygen from the blood in the left ventricle, but that's not true. It has its own blood supply through the coronary arteries. The aorta is the largest artery in your body, coming right off your heart. The pulmonary artery we talked about earlier carries deoxygenated blood from the heart to the lungs. Carotid artery are on both sides of your neck, and they're what supplies your face and your brain with its blood supply. And the femoral artery runs down the inside or the medial aspect of your thighs. Brachial artery is right up here by your bicep. Of course, the radial artery is the one we always feel for when we feel a pulse. Posterior tibial artery is right behind the knee. And the dorsal pediis artery is on top of your foot. And just a little sidebar or a special note, if you have an injury and you are splinting that injury, you're going to feel for a pulse before you splint and after. You find a pedial pulse or a pulse on top of your foot, you take a pen and mark it, because they're hard to find sometimes. So if you mark it, it'll be easier to find. Here it explains arteries, capillaries, and veins, how they're tied together. This is what's in our blood, right? The largest volume part of our blood is plasma, the liquid, more than half of the volume. And then we have red blood cells or erythrocytes, which are the red blood cells. The white blood cells are your leukocytes. Let's go back to red. I'm sorry. The red blood cell's job is to carry oxygen. That's its job. The white blood cells or leukocytes are there to fight infection. They're the army, the troopers, right? They're the soldiers. And the platelets are there to plug holes. They're the clotters, right? They're what causes blood clots and clotting. So they're going to clot the hole. Pulse, the pressure wave of blood flowing down an artery when the left ventricle contracts. You feel a pulse by compressing the artery over a bone. That's how we feel for a pulse. Peripheral, or the outer part of your body pulses. These will be in your arms and legs. Radial, brachial, posttibial, and dorsalis pedis for the one on the foot. Your central or your core art pulses would be your carotid and femoral arteries. That would be the pulses near the center body part. Carotid and femoral pulses can be felt when the peripheral pulses are too weak to be felt. We'll talk about this in more detail when we get into shock and bleeding. Blood pressure is the force of blood exerted against the wall of a blood vessel. When we start talking about blood pressure, we have two numbers, an upper reading and a lower. The upper is your systolic number. This is the pressure when the left ventricle contracts. And the lower number is the pressure when the left ventricle refills or when your heart's resting or relaxing. So which number should be smaller, the top or bottom? That's right, the bottom should be smaller. Perfusion is adequate supply of oxygen and nutrients to the cell with removal of waste products. This term hypoperfusion is the term shock. We'll hear this quite a bit, especially when you start talking about trauma. It's when perfusion becomes inadequate. Your cells will start dying, and eventually your organs will start dying, organ systems will die, and eventually the organ or the person will die. How is the function of the respiratory system related to the function of the circulatory system? They're hand in hand, right? Without each other, you wouldn't be here. And you need the respiratory system to breathe in air, bring in air, and exhale the waste CO2. And you need the circulatory system to move that oxygen and nutrients throughout the body to the cells. So they work hand in hand. Interaction of life. Interaction. We just talked about this, right? Lymphatic system. The function is to capture fluid, maintain a fluid balance. Your lymphoid organs, or your tonsils, spleen, your thymus, your nose, your adenoids, right? Where's your adenoids? They're in your nose area, right? Tonsils, spleen, all these. Avoid taking blood pressure on the side of the body when a woman's had a mastectomy. That's why we ask, is it okay if I take blood pressure on this arm? Because if they've had a mastectomy, the breast tissue is a source of creating these lymphatic system or these lymph nodes, these lymphoid organs, and you'll crush it, and then won't have any to help fighting the infection. The nervous system, we're going to start talking about that now. Central nervous system consists of the brain and spinal cord. That's your central nervous system. Your peripheral nervous system is your sensory nerves, and your motor nerves. Anatomic nervous system, involuntary motor function, right? This is stuff we have no control over. Oops. Involuntary, like your heart rate, digestion, stuff like that. Talking about digestion, let's talk about the digestive system. This is where we intake food and it goes to the body and gets digested, and the nutrients are absorbed and the waste products are produced or formed in the feces and then expelled through the anus, right? So it consists of the stomach, small and large intestines. We also have the anus, the colon, accessory organs, the liver and the gallbladder. Liver and the gallbladder are the bile and bile storage unit. We need bile to break down food and to absorb it. Your pancreas and spleen. Your pancreas secretes a chemical that neutralizes your stomach acid when it comes out of the stomach. Appendix and spleen. Spleen does a minor role in digestion, but we're not really for sure what the appendix does. Functions. The integumentary system for your skin, right? Functions: protection, water balance, temperature regulation, excretion, and shock absorption. This is all what your skin does. We have 3 different layers in our skin. We have epidermis on the outside. Our next layer is the dermis, and the last layer is your subcutaneous layer. This will come into play when we start talking about burns, really big time. There's a nice picture of those layers. We're going to move on to the endocrine system. This is the system that produces the hormones that regulate the body. We'll start talking about homeostasis later on. That's what these hormones are for. Some of the glands or organs or your adrenal gland, they secrete epinephrine for fight or flight syndrome. We'll talk about that next chapter. The pancreas, it creates insulin. That's its main job. And what's insulin do? It's the key to pulling glucose into a cell, right? A lot of people think that it burns off glucose, but it does not. It makes the cell membrane penetrable. It lets the glucose penetrate the cell membrane. It's the key that opens the cell. Here's a nice picture of the endocrine system and where the glands are located. Renal system, it's your urinary system, right? So what's it do? It helps to regulate fluid levels, filters chemicals, and it keeps your a constant pH level. The body's very sensitive to pH changes, and the urinary system is one of the big takes a big role in keeping a constant pH. This is consists of the kidneys, which is the principal organ in the renal system. Kidneys do a lot. They're very important, and you have to have at least one to survive. Bladder. It's the fluid reservoir for urine. It's where the urine is stored. Once the kidney has filtered the fluid and made it into urine, then it goes to the bladder. Here's a nice picture of that. Ureters are transport urine to the bladder from the kidney. This is a whole tube that moves urine from the kidneys to the bladder. Urethra is what excretes urine from the bladder to the external environment. So this runs from the bladder to the end of the penis or the opening of the vagina. Male reproductive system, testes, and the penis. Of course, the testes is where sperm cells are made. And then the penis does multiple things. Nice big picture of the male reproductive system. Female reproductive system consists of the ovaries. They didn't put it on here, but fallopian tubes, the uterus, and the vagina, right? So the ovaries where the egg is made, it travels down a fallopian tube, goes to the uterus, it comes in contact with the male sperm, and then it embeds on the uterus. And then after 40 weeks, it's pushed out of the uterus and the baby is delivered through the vagina. Here's a nice picture of the female reproductive system. All right, chapter review. As an EMT, your knowledge of anatomy or its structures and the function or physiology of the body will be important in allowing you to access your patient and communicate your findings accurately and efficiently to other EMS personnel and hospital staff, right? Major body systems, which you should be familiar with. The musculoskeletal system, the respiratory system, cardiovascular system, nervous system, digestive system, the integumentary system, which is your skin, endocrine system, renal system, and your reproductive, both male and female. Cellular metabolism requires a constant supply of oxygen and glucose. Absence of either component disrupts normal metabolism, and we will definitely talk more about that next chapter. Cardiopulmonary system combines the function of the respiratory and cardiovascular system to provide oxygen at the cellular level. Shock occurs when the cardiopulmonary system fails. It's called hypoperfusion, right? The body is composed of primary water, and the fluid is distributed throughout the body systems using both the cardiovascular and the renal system.